Hello, everyone, and welcome to another edition of Greater New Orleans on LAE, television worth watching. This program provides community service opportunities for graduate students to help those currently underserved by our healthcare system. It is a collaboration between the Louisiana Public Health Institute, Louisiana State University, LSU, and Tulane University. And here to talk more about the New Orleans Schweitzer Fellowship program are Raymond Tsai, Program Director, and Holly Scheib, a Schweitzer Fellow. We welcome both of you to Greater New Orleans. Good to have you here with us.
Thank you for having us.
Raymond, let's start with when the New Orleans Schweitzer Fellowship program launched. What's it all about? Let's start there.
Absolutely. The New Orleans Schweitzer Fellowship program started in April 2008. It came about because a professor at Tulane School of Public Health and Tropical Medicine bumped into one of the national board members for the National Albert Schweitzer Fellowship program, which is a very prestigious national program. And they decided they want to start up a program here in New Orleans. And so in April 2008, we started with our first 12 fellows that come from Tulane University, LSU, as well as Xavier University. And collectively, they represent our first class of New Orleans Schweitzer Fellows, and we're very proud of that.
What was happening on a national basis? What is the program?
The program was started in 1991, the U.S. Schweitzer Fellows Program, and it's modeled after the ideals of Dr. Albert Schweitzer, who was a German theologian, musician, and a physician who in 1913 opened up an hospital in Lambaréné, Gabon, to serve the indigent population there. And the U.S. Schweitzer Fellows Program really wanted to instill that ideal of service in U.S. students. And so they offer small stipends for students to provide local community service to address unmet health needs in their community. And so the New Orleans Schweitzer Program is the newest of 10 programs. The other programs exist all over the country from Los Angeles to Boston. And they just saw such an immense need here in New Orleans that they wanted to start up a program here. And so they approached the Louisiana Public Health Institute as a convener and as an administrative home to start up the program here in New Orleans.
Earlier in the week, we talked with city business about the stalling of the charity hospital and that debate about whether or not the building will be rebuilt or torn down and another one. Obviously, there is a real need for the services you are providing. Give us a sense of who's being served and who is it and why it's important work that's taking place.
Absolutely. Well, I think the number one person that's being served are the fellows themselves in a certain way, because what this really offers is a really unique, mentored, entrepreneurial, and cross-disciplinary model of education, where the fellows themselves are able to identify an unmet health need that they see in the community, and then design a project and implement a community service project to address that unmet health need. And so that's really exciting. In addition, obviously, each of these projects addresses some need in the community. And so we're going to hear a little bit later from Holly, but some of the projects are, for instance, one fellow is doing hip-hop classes in the community because they want to address obesity in young adults. And so he's doing that through hip-hop classes.
Do it in a way that students will listen.
Exactly. Another student is a law student at Tulane University, and he's working, he's opening up a pro bono law clinic on Saturdays to give bilingual legal advice to the new Hispanic population that's coming into New Orleans. And so each of the fellows themselves devise some sort of interesting project that they're very passionate about to address that unmet health need.
All right. Holly, let's find out about your passion. First of all, how did you hear about the program, and what is it that intrigued you about it?
Well, I'm a PhD student at Tulane, and one of my committee members suggested the Schweitzer Fellowship to me because I've been volunteering with the Latino community since Hurricane Katrina. After the storm, my plan was to move to South America to do my dissertation, and with the changes after the storm, my husband and I looked around and said,
South America moved to you.
Exactly, that's exactly right. And we decided to stay and be a part of rebuilding. And I began working in the community as a volunteer and continue to do so. And my committee members have been encouraging me to do this along with my dissertation research. And so when a friend of mine, my committee member, found that this was going to be an opportunity, she sent it on to me and said, you sound perfect for it. And it is a wonderful, wonderful fit. You know, the first job of a graduate student, and especially a PhD student, is to graduate, is to get done. And this is a very unique opportunity.
That's the mantra from parents all over the country.
That's exactly right. So to have an opportunity to volunteer within this fellowship environment is really quite unique, and I'm really lucky to have had the opportunity.
What were you studying? What are you studying as part of your PhD, and how does that dovetail into the actual work you're doing in the community?
Well, my PhD is in international health and development, and if you really boil it down into one small phrase, you can say that I study inequalities in health. So although it's international health, certainly there are spheres domestically that fit the calling for my degree perfectly, and one of them is looking at health inequalities within the Hispanic population here in New Orleans.
What have you found as you started to dig deeper?
Well, what's really interesting about Hispanic immigrants in particular is that among the most healthiest people in our country are first-generation immigrants. Believe it or not, the healthiest people, statistically speaking, are immigrants. They have higher or lower levels of morbidity and mortality than sort of the average American. Where it becomes even more interesting is in the second generation, children of immigrants. Their health outcomes are significantly less desirable than their parents. We really don't know what happens in that in-between. So looking here in New Orleans, I'm interested to see how people are utilizing the healthcare system. Are disparities due to a difference in usage patterns between parents and children? Are certain parents more likely to seek health care than their children? So those are some of the questions I'm trying to answer.
We talked about some of the challenges of just finding places to get health care. Are you actually getting people into health care, or are you just looking at the system of perhaps why they are or aren't getting the health care they need? And what you're doing?
A little bit of everything. I've been doing translation and advocacy and outreach. A lot of when people don't use the healthcare system, they don't because they don't know where to go, they don't know who to see, and they don't know what it's going to cost them. And if we can figure out the answers to those questions and tell people the answers to those questions, then people will use the system.
Okay. You have Holly. How many others do you have now?
We have 12 Schweitzer Fellows total. And we're hoping that the program's going to grow over the next few years to include 15 to maybe 20 Schweitzer Fellows.
Okay. Tell us about the requirements, the kind of people you will be looking for to replace Holly when she moves along.
Well, I don't know if we'll ever be able to replace Holly or any of the fellows, but the type of students that we're looking for they have to be graduate or professional level students. They have to be involved in healthcare in some sort of way. And we take a very broad definition of healthcare because we believe healthcare is mind and body. And so we'll take music students, we'll take social work students, we'll take law students as we have, pharmacy, public health, physicians, whatever graduate or professional school student there is. And what we're really looking for is a commitment to service. People that are really into giving back to the community and doing service learning.
Are there examples through the years, especially as you look at the national organization, of people who have started as volunteers and said, boy, this can become a business, or this can become a lifelong ambition? Are there examples of that? And certainly I would guess that is the hope.
Oh, that is absolutely the hope, and I think there's several examples of that. I wouldn't say that any of the Schweitzer Fellows open up a business because a lot of what they do is really to serve the community, and so they try to figure out a way to serve. But one of the stories is, as this program started in Boston, and so a student from Harvard Medical School was noticing a really high incidence of hepatitis in the Asian American community in Boston's Chinatown. And so she tried to figure out why all of a sudden Chinatown was there this high incidence of hepatitis. And she found out through her studies that it had to do with how much they trusted the American healthcare system. Because if you're not from here and you don't speak the language, and someone comes up to you and says, I want to give you a shot of this disease, just a little bit though, it won't really hurt you, it'll make you better.
If you don't understand the vaccination process, right?
You're not going to do it. And so that's what she found out. And so she devised this whole health education curriculum and has become pretty much the standard for CDC to how to approach immigrant populations and non-English speaking populations on issues such as immunizations.
You brought along a couple of pictures. The first one looks like a member of the